I recognize some of you in the crowd, so it's good to see you all. And again, thank you for your letter of support for our dental clinic, which is amazing, so I'll talk a little bit about that. I'm just going to start to tell you about our services. We do provide medical services. We have 2 primary care providers on staff. We have Dr. Lois Niska and we have Matthew Lassen, who is a physician assistant. They are both wonderful providers. Matt is just an awesome gentleman. I can't tell you, I just rave to people about him because he's so kind and so down to earth. They're both just tremendously knowledgeable. We are open, they're in the clinic. Dr. Niska is there Monday through Thursday from 7:30 to 6. And Matt is there Tuesday through Friday, 7:30 to 6. We see our first patient at 7:45, and our last patient is scheduled at 5:15. So we try to provide late service hours and early morning so that people, if they have to work, can come to an appointment before work or possibly come after work. And I think that's a really neat thing. Going back to what Lindsay was saying, we see everybody regardless of ability to pay. That is true. We will never turn a patient away for not being able to pay or not having insurance. So even if they come in and the copay is $20 and they say, I have nothing in my pocket today, we're going to see that patient. So I think that's really important to know coming. I once worked in a clinic where you didn't get seen if you didn't pay the bill, and that was really, as a nurse, that was really heartbreaking to have to tell somebody, we're not going to see you today because you couldn't pay. So I always like to stress that. Both of our medical providers see a wide variety of patients. They're family doc providers just like any other family doc provider in town. They manage diabetes, they manage hypertension, they do yearly wellness exams, they do yearly annual Medicare exams. That's a new thing that Medicare is offering. They are able to do that as well. Behavioral health, that's a big one. That's a big issue in our community. We have 2 behavioral health providers. Dave Keene is there full time. He's our male provider, and then I have Andrea Charles, who comes up twice a week from Lewiston. We share her. It gives patients a variety between a male or a female provider. It's very important. They are very booked out. They see a variety of patients for depression. Dave does a lot of case management, helping people fill out Social Security forms, disability forms, just handling day-to-day crises. I don't think I could make it through the week without Dave. He's a lifesaver. They both are a lifesaver. They both bring something new to the table. Dave's been a behavioral health provider for 25 years, and Andrea's just recently graduated, I think 3 years now. It's very unique to have those 2 different perspectives. So, and Andrea does a new treatment, EMDR. I don't know if anybody's heard of that. It's for PTSD. It's really neat service she's doing. So every day of the week we're able to provide a behavioral health person in the clinic. So, and if we have one of them on PTO, then I reach out to my Lewiston clinic for support. So that's very important to me. We just opened dental. We actually started dental back in the old clinic. I don't know if some of you knew that, but we opened in October and we offered services on Mondays and Fridays that were very limited. We called it the MASH unit. We took the procedure room and we made it into a little dental op. They were able to see 1 patient an hour because of the turnover. But it was really fun. It was a good team building experience for us to get used to dental. And so when we moved to the new clinic on December 12th, we opened with dental. We are open Tuesday through Friday, 9 to 6. We are trying right now to recruit another dentist and hopefully 2. I will tell you that we are booked 6 weeks out. We always have 2 to 3 same days appointments that we don't fill until the day of, just for emergency dental pain, emergency kids with dental pain. Those are usually filled by 7:45. The phones come on at 7:30. So that is a huge area that we need to expand because there's definitely need in the community right now is for dental services. Dr. Campbell is our dentist right now, and our hours are 9 to 6, Tuesday through Friday. We provide a full range of dental services, fillings, cleanings, extractions. We don't remove wisdom teeth. We do refer out for some surgical procedures. We do have nitrous, though, available, so if we have kids or even adults that just get very anxious, if you're like me, I get anxious when I go to the dentist, so I think that's great that we have that to provide. So, and then we have our dental hygienist who is there Tuesday through Friday as well, providing dental hygiene services. We see kids, we see adults, and it's the same concept as medical. You don't have to have insurance, and you don't have to pay at the time of services to be seen. So, if you are calling for dental services, I know it is 6 weeks out, and we are working very, very hard to try to provide improved access to the community for that, because I think it's a huge area of need. A huge area. Yes?
How will that work if you have to refer out, like for wisdom teeth, as far as the payment goes?
Yeah, it is a challenge. We have a patient service coordinator that helps patients find an appropriate dentist to go to that will accept their insurance or take payments. It is a huge challenge to refer out. I will tell you that. There is not an oral surgeon down here that's taking any kind of Medicaid or sliding fee. We end up having to refer out to Spokane. That being said, we do help patients with gas cards to get to the appointment. Yes, we do everything we can to help get them to where they need to go. But it is a huge challenge. And it's the same way in medical for referrals to specialists. We have a hard time finding specialists that take Medicaid or take self-pay. So our patient service coordinator that we have on staff works very hard to help find patients resources to get to those appointments and get to those specialists.
Has Obamacare helped with that at all?
It has helped some, and I know Lindsay's going to talk a little bit about that.
Okay,
So you want to talk to me about that now?
that's okay.
We can. Yeah, Lindsay's going to talk about that because it's helped some, but she'll share a little bit more about that with you. So, pharmacy, we do have a pharmacy. It is a 340B, and it's very confusing to patients sometimes to understand that. You can only utilize the CHAS pharmacy if you're a patient of the CHAS clinic. So if your primary care provider is Dr. Niska, that qualifies you to use the CHAS clinic for your primary care meds, for your maintenance medications. If you go see the dentist and she prescribes maybe a fluoride toothpaste or an antibiotic, you can use the pharmacy for that as well. But if you're not a medical patient, you can only use it for the dental prescriptions. That can be confusing. If we refer you out to a specialist, if we refer you to that specialist, you also can use the CHAS pharmacy to fill that prescription as long as your primary is still a provider there. So that gets a little confusing, I think. Even I find it confusing at times, but my pharmacist is very good at explaining it, knows all the 340B rules. And you do want to make sure you follow the rules or you can lose that funding. So, but we work very hard to ensure that you are able to use the pharmacy if you're a CHAS patient. So, our pharmacists also, we have a diabetic educator pharmacist, Shelley, who's very good at helping patients with adjusting their insulin, learning about their insulin, learning about their diet. We also have Carrie, who helps with anti-coag or coagulation clinic. If you have somebody who's on a blood thinner like Coumadin that has to be monitored, she helps with that. She helps adjust their dose and ensures that we're monitoring them correctly. So it's a big program. Other things that we provide, we have all the state immunizations. We are part of the Idaho State Immunization Program for Children, which means the state of Idaho provides immunizations for children under 18. We also have what we call our CHAS immunizations for people who are over 18. So we carry all the basic Tdap, pneumonia, zoster vaccine, flu vaccine. So we have a full immunization program for our patients. We do lots of family planning, women's health in our clinic. We do well child visits for any age of child. We do health screenings. You've all probably heard of hemoglobin A1Cs for diabetes, getting your lipids checked every year. Just those point-of-care tests that are important that you have every year. If you're over 50, we do the IFOBTs. You've probably heard that. So we do all that. Prescription assistance, I always like to promote this because I think this is very, very important. Lindsay helps obtain lots of grants so we can provide medication assistance to our patients. A lot of our patients do not have Medicaid, and so they come in, they're on a sliding fee scale, but they still have to pay for their medications. And if they have no insurance, no money, they can't get it. So through these grants, we're able to do that. But we also get lots of donations from the community. We recently got the Moscow Giving Circle grant. We get lots of church donations. We even get just individuals in the community. That money that we get always goes into our fund for medications to help patients. So if you're donating to our clinic, we make sure that that money is going to go right back to the community. And we've been really fortunate this year. I can't remember how much we have. We've gotten over $8,000 this year to help patients with their medications. So if you come in and maybe you need an antibiotic, sometimes we have diabetics who aren't taking their insulin because they can't afford it. We'll use that money to get those medications for them because we want them to stay